Hi, I'm Prashant, and this is Robert. He's been an amazing, great patient of ours at this practice. We've had him here for what? It's been 2 years since we started, and I've had the pleasure of treating Robert's wife as well, who actually went through quite substantial work. So I got to say, it's very humbling that she actually recommended us. Somebody going through this process, it's a tough journey. So yeah, Robert came in with a fractured front tooth, and generally that is symptomatic of other more overall holistic problems in the mouth, and he was quite typical of that, where there were multiple fillings, multiple old works that were failing, missing multiple teeth. So the foundation was shot. There was no way I would put a single tooth and expect that would last any reasonable duration. Anybody can put an implant in there and replace a single tooth and expect it to last 5 years. That really isn't our motto here. I mean, I'm trying to fix people's teeth so that they can move on with their life and not have to come back and keep fixing things. And with him, the formula was simple. Ideally, he should have bits that are missing replaced, and bits that are broken repaired. And the front tooth was part of that solution. That's the easiest part to fix. However, it's not that simple to say, hey, you must have this. There were 3 options. There's always options. So we went through our options, and thankfully Robert was able to assimilate all the information, and he was very kind enough to say, okay, well, this is what I think I should be doing. I agree with you. I trust what you're saying, and I will go with that, which is what happened. Now, that doesn't happen every time, so when it does happen, I can assure you the results of the treatment are fantastic. Always, almost always, there's not a problem with the treatment. It's usually the decision and the rapport at the start. That's what happened with him. We went through the journey, repaired bits. Again, in a temporary fashion, you always want to make sure that it's all working properly. Can the patient eat with the new bite and the new shape of teeth that we're providing? Is the patient happy with the way things are looking before we commit to the final restoration? Those things take time, and they usually, I prefer to leave it for 3 to 6 months before I know that the patient's absolutely comfortable with what we intend to provide, which is what happened with him. Gave him the temporaries, made sure he was happy, made sure I'm happy. And then we went ahead and slowly replaced it with the final restorations. They take time. There's no desire to rush anything. If it takes 3 hours, 10 hours, it's irrelevant. The objective is to get a treatment that will last and that the patient walks away happy, knowing that these things will be stable. And that's exactly what I think we've achieved here with Robert.